Dear friends, we are happy to see you once again Saturday, 22nd March 2025. We have successfully completed 1,545 cases of Puberphonia. The 45th case today is a Punjabi gentleman is working in London. So our Puberphonia treatment is well recognized by the Puberphonia boy throughout the world. That is why I am strongly telling that Puberphonia is a common problem throughout the world. So we have conducted few studies in colleges and we are able to get average of 2 cases in 1,000 boys attending in a college. But it should be more. But they are reluctant to expose themselves because of some unknown mental or psychological feeling, because it will destroy their self-esteem. And the professors know some of the boys are having low confidence, anxiety, depression, and various avoidance behavior. Avoidance behavior. Mostly they are lonely. They never mingle with other boys. But they'll be happy with a few good friends. So these things indicates the puberphonia may be more in the general population. That is why we are getting, so far we got 1,545. That every day we are seeing, and we are doing group therapy. So they are happy. So far the analysis we have done, we are able to get from Tamil Nadu 891 cases, Pondicherry 174 cases, Andhra Pradesh 222 cases, Telangana 193 cases, Karnataka 194 cases, Kerala 195, Punjab 12 cases, Madhya Pradesh 14 cases, Rajasthan 15 cases, Arunachal Pradesh 2 cases, Assam 2 cases, Bihar 12 cases, Gujarat 6 cases, Maharashtra 21 cases, West Bengal 6 cases, Delhi 4 cases, Bangladesh 1 case, Nepal 3 cases, USA 2 cases, Australia 1 case, Sri Lanka 22 cases, Switzerland, that is the only patient I got from European community. Singapore 5 cases, Malaysia 17 cases, UP 22 cases, Jharkhand 9 cases, Odisha 12 cases, Maharashtra 60 cases, Haryana 6 cases. So we are getting good number of cases and we are analyzing daily. So the patient is having a good confidence with us in treatment of puberphonia globally. So they are coming to Chennai to take treatment because our treatment is very simple, no operation, no medicine. Only uvula we are strengthening with a thread. That too we will remove it on the third day. Our concern is in pure puberphonia, the structure and function of the larynx is normal, and the puberphonia boys get normal voice sometime. Sometimes they can cough and get the normal voice. When you do exercise, they will get the normal voice. So they are having normal voice in their own system, but somehow there is no correct maleness, strengthness in the voice. That is what we are more worried, and they are also worried. So that is why we have brought a new classification also for puberphonia. Even though all over the world they are following different classification, but we are postulating some new theory by which we will be able to know and assess the puberphonia to a great extent. So that should be accepted well in advance, definitely, and that will help the puberphonia voice to take early treatment. Most of the puberphonia boys refuse to take early treatment. They are willing, but the parents and their friends, they will feel then voice is almost normal. But the voice will get dejected. When they are in the phone call, the opposite party feel they are having female voice. So they are recognized as ladies or girls. So we want to create a impression in the world. Puberphonia is a very common problem and it needs immediate treatment. It needs treatment because without treatment, puberphonia won't get automatically, it won't get all right. It should be treated. But how will you diagnose puberphonia? That is another big problem. They themselves know their voice is not matured. But the world, parents are telling you are all right. Why parents are telling means they will ask some doctors, they will ask some great people, educationalists. They will only give their suggestion. Even if you are having puberphonia voice, you can become great. That is the word they will tell. They will try to console the puberphonia voice. They will try to encourage the puberphonia voice indirectly. How it means, even with puberphonia, you can become a bigger person. But they will get upset. So they and parents understand that it cannot be treated. And added to that, when a disease is not able to treat it and it is there for a long time, they feel it is a congenital problem. It is a hormone problem. So if you do hormone test for the puberphonia boys, it is normal. We have done 300 cases hormone test, androgen study. testosterone study. They are having normal. But what will happen? We have to think it. When they think a male boy feels I may have the female tendency. Puberphonia boys, when mingles with his friend, they are treating them as female mean they will get dejected in life. They will live separately. They never want to mingle with other people. They won't travel in bus because they are hesitant to ask the driver conductor the bus ticket. Because of the puberphonia boy, the conductor may feel why this boy is talking like a female tone. So these are the ugly situation they will meet and they will get dejected. So modern times, even though lot of treatments are available, still some belief is there in the society that we are not able to take it out immediately. But this awareness will come. Then only they will understand that puberphonia can be easily diagnosed and they will get the normal voice early. Puberphonia boys, we are repeatedly telling they are having female voice or child voice, but most of the time they won't talk. Inaudible voice will be there. So everybody feel this is a mutated voice. No, they never want to talk. That's all. This is why the diagnosis also will have a different view. What happens when we talk? See, the air energy is converted into acoustic energy by the vocal cord. Any vibrating surface, if air passes, it produces vibration and sound. God has not given us phonatory apparatus. We are utilizing. We utilize the respiratory organ for speech because where vocal cord vibrate in response to the air coming in that area, when it vibrates by the aerodynamic force, it creates noise. That noise in the supravocal tract, above the vocal cord, in the pharynx, in the nose, in the mouth, it gets resonated and articulated. Articulation is formation of words. So when this vibration occur at the level of the vocal cord, the voice is created. That voice is always high pitch. Child cries. Child is having high pitch voice. That continue in the children age group. But when it mature, boys, the screaming voice will be there for in girls for their protective function. Girls want to have protection means they will shout. But boys, when they want protection means they will fight. So that is the phenomenon behind in change of the voice. So the laryngeal voice is redirected to the pharyngeal voice. Laryngeal voice is having high pitch, pharyngeal voice is having low pitch. When this break has not happened, it is not obvious always. In singers, they will find out easily at the stage of 15th or 16th year, voice break, the high pitch voice of a singer will change to low pitch. See, this is what's given in ancient literature. When boys are singing below the age, when they get the age, voice break happen. So they never want to have a break in the voice because high pitch, they are habituated. A little singing boy in a girl's voice, well appreciated. So what they will do to continue the voice, continue the high pitch voice, continue the female voice, they try to give hormone. That is the starting point of hormone therapy for making the voice to sing in high pitch. So these are the history follows. So when these boys are having adulthood as a puberphonic voice, inaudible voice, they try to give hormone. That will become for generation, give hormone. So they nowadays also a puberphonia boys mean we try to do hormone test. That is normal. We have done 300 cases hormone test in cases of puberphonia, but their voice is completely female and the hormone is completely normal as male. But this you have to think for a while. When they are thinking, am I a girl? Am I a girl? Then they will get depressed. And so many changes happen, make them to feel they are girl, they recognize themselves as girl, what to do? Because of the voice not changed. Then they have given the different name. It is a mutated voice. It is a changed voice. These are all not mutated voice at all, but they will try to behave like that. So number one, they will have inaudible voice. That's what we are telling. Their vocal tract is not working for so many years. They won't talk. That is why our findings, it is a lazy vocal tract. We have to make them a strong vocal tract. We have to train them. Then only they will get the adult male strong voice. Without fatigue, they can talk. The child voice will break into adult voice. No more they will have a female voice. So many of the puberphonia will have double voice. For double voice, so many good articles have come. But I personally feel that are all the reason what they are suggesting is their own idea. Double voice means they say one vocal cord is working, other vocal cord is working, so double voice. My feeling, it is not like that at all. One voice is from larynx, and another voice is from pharynx. This is very well seen in cases of the great actor M.R. Radha. He can talk with low pitch and high pitch. Everybody will appreciate his voice. So you can say it is a modulation. So all the puberphonia boys are having normal male voice also, but it is not exhibited always. So it present as a double voice or nasal voice or not strong manly voice. So they are having double voice. Somebody interrupt and say it is a hoarseness. So these are the symptoms. I personally feel the whole problem is different understanding. That's all. It is not a mistake of anyone. So they feel they are having a trouble in making voice. That is why emotional causes, psychological problems are developing into puberphonia. Delayed development of sex character. So the puberphonia boys will have more hesitation to talk with girls because of the voice. What the world say, they have not developed a manly character. That's why they are not behaving as a man to a girl. They are not fond of girls. They are fond of girls. Puberphonia boys are fond of girls. But the girl is not accepting. That's what you have to understand. The girl feel because of the puberphonia voice whether a lady character is inside him or not. So these are the problems are there in the society and individual. This has to be challenged and it should be removed. A self-consciousness they should develop. So already all these things are not taken into account and this it is a false voice, mutated voice. So that is it is not a false voice at all. Added to that, they say some more congenital anomalies will be there. Congenital vocal cord asymmetry will be there. Muscle incoordination will be there. Even congenital anomalies of the larynx, vocal cord. They think, but it also exhibits. That's what another feature. As I am going on telling, in puberphonia, the larynx is lacy. So it is proved already in puberphonia boys when they talk, vocal cords, there may be a gap in the vocal cord. A unilateral vocal cord paresis will be there. So lot of confusion. So vocal cord gap will be there. Bowing of the vocal cord is there. So the ENT surgeon, including me, try to fill up the gap with some implant. Definitely that will give few cases very good result. But it cannot be a permanent one. That is why strongly we are feeling and we are giving that when we are not doing any surgery, any mutation, any alteration in the vocal cord or larynx. When voice is rehabilitated, a female voice is changed to male voice by our training or uvula manipulation. These boys will recognize their voice is similar to their parents, similar to their brother. Some element will be there. So, when we change the voice from puberphonia voice to an adult male voice in puberphonia treatment by our Umar technique, uvula manipulation and resonance technique, these boys, when they get the male voice, they will be happy and it will be permanently retrained, stayed in their mind. They will recognize in the mind and the treatment will be permanent because what the voice they got after Umar treatment is their own ancestor voice. How can once again it come back? It will never come back. So that is what given us a great confidence in treating puberphonia boy. We are boldly telling the puberphonia boys when we treated, it will be mostly they are having a permanent change. But what happened is in our cases of 1,544 cases, actually 11 cases out of this 11 cases, the boys are little nearby only. They come for second time treatment, third time treatment also to us, which we are doing freely. Because the friends are telling, parents are telling, your voice is the old thing, it has not changed at all. See, this will happen always. When we change the voice, they are normal, they are happy. But some friends will tell, oh, your voice is similar to old one only. Because they actually, even though it is normal and happy, few are celebrating it, few they will recognize the same old voice when see the boy with the puberphonia. So they come once again with good encouragement, and then once again they take the treatment. We confirm the pitch as male pitch, and then they are happy. So nowadays we are aiming to treat this puberphonia with uvula manipulation in more easiest way also. Every day I am thinking any new methods by which we will be able to spread the message of treatment of uvula manipulation simply. Then the speech therapist and physiotherapist, occupational therapist can do the uvula manipulation and treat thousands, millions of puberphonia boys. I am or we are on the research of finding a new instrument for uvula manipulation and the resonance what they will get. So even though we are getting the resonance by nasal resonance, nasal voice and buccal resonance, pharyngeal resonance, we are adapting some new technique by which if we are able to get it means it will simplify our research and it will be more acceptable if independently the speech therapist or occupational therapist or even physiotherapists treat puberphonia mean globally our treatment will be recognized and all will be happy. We can eradicate puberphonia. That is what we wish. So happy we have finished 1,544 cases of puberphonia on this Saturday, 22nd March 2025. Hope we are able to give a good thing. We'll meet next Saturday. Thank you. Great, great, happy, happy, happy.